Thank you all for joining, and I will now introduce our presenter for today. Elainya Hawkins is the Panel S specialist at COMERB. She has been with COMERB for a year and has worked in research for 2 years. Before working with COMERB, Elainya worked in the Children's Hospital Immunodeficiency Program. When she started with COMERB, Elainya was a panel coordinator and pre-reviewed expedited and full board studies. Currently, Elainya is with Panel S, and she works with social and behavioral studies as well as international studies. During her time with COMERB, she has had the chance to review exempt, expedited, and full board studies. Thank you, Elainya, for being here today. We are happy to have you with us, and I will stop sharing and turn over the floor to you.
Perfect. Thank you so much for the introduction. Let me share my screen. Can everyone see it okay?
Looks great.
Perfect. Yeah, so as Victoria said, my name is Elainya Hawkins. I'm the Panel S specialist. And today I want to give you some tips for a successful IRB submission. We know that the submission process can be confusing and it is definitely easy to forget steps along the way. So my goal today is to just give some helpful reminders on how to make it a smooth process. So here is our agenda today Our agenda for today. We're going to go over personnel requirements, initial submissions, amendments, continuing reviews, UAPs, and then what to do when you want COMERB to be your single IRB and what to do for just-in-time submissions. So for personnel requirements, all investigators need to be up to date on their city training. And this is something that can be displayed on the personnel e-form. So you can always check this before submitting. And I will talk more about city on the next slide. The COI, which is the conflict of interest disclosure, needs to be done every year, and it runs August to August, which means if you did it in July this year, you would have to do it again in August. And we are currently in the COI collection period, so I am sure you guys are getting reminders right now. This would be something that is completed in InfoEd. For our next personnel requirement, that would be your CV, which needs to be up to date and uploaded in InfoEd. And this is something that needs to be current because we do check this to make sure that you have appropriate treatment relationships and the appropriate expertise on the subject. So if it says, that you're a student, that's definitely something that we're gonna check in on and make sure that it's accurate. Yeah, and when you upload your CV, this is something you're gonna have to update if you have a new appointment or if there's any changes to your role, and it has to be uploaded as a PDF just so that we are able to see it. So next, city requirements. We require human subjects training and HIPAA training. For human subjects, we want either the Group 1 biomedical investigators or the Group 2 social and behavioral research. This would be just based on the research that you're doing. If you're doing more of a social and behavioral research study, then it'd be best to do Group 2 because that would give you the required training for it. We also have the HIPAA training that is required. This is if you have access to any personal health information, PHI, and that one is called City Health Information, Privacy, and Security, HIPS for clinical investigators. This is something that we check very regularly to make sure that you have this done. Once you do it, you have 3 years before you have to do it again, but it can be easy to forget with that long expiration date. And we also have the GCP training. This is something that you can do instead of the human subjects training because it will meet the NIH requirement. There are 2 trainings that you can do. You can do the Group 4 ICH or GCP training, or you can do the GCP for clinical trials with investigational drugs and medical devices, which is the FDA focus. And that was an easy way to get an NIH requirement and also reach our human subjects requirement. So a common problem that we see with city trainings and InfoEd is that they are not syncing. So this means you did the training, but we're unable to see it on our end in InfoEd. This is usually because the wrong ID number is in city. So you'll have to go to your city, go to your profile, choose the institutional profiles, go to the UCD edit profile, and then that's where you would put your employee ID or POI number. And this is something that we can always check in on. So you can always shoot us an email and we can check in to see if your profile is synced up or not. And this is also something that you can see because when you're in InfoEd, you can see the certifications that are listed on your profile. That is just a common thing that we see. So we're on to initial submissions. And before you submit to us, it is best to have an institutional clearance because if you don't have it, it'll just end up delaying the review and there'll be a lot more back and forth. So it's just best to have these institutional clearances first. And for these clearances, we have the CHCO Research Startup, we have the Health Data Compass clearance, Human Subject Research, the PRMS, SARC, Sparrow, and the VA clearances. And we know that there are times where you need to have a COMERB number before you can even submit to some of these clearances. So you can create a shell and InfoEd. We just ask that you do not submit to us until you have that clearance. So still on initial submissions, we have non-English speakers scenarios. And we want to know if you're going to translate the consent forms or if you're going to use the short form. For us, the short form can be used up to 3 times before you have to translate the consent forms. So if you know that you're likely going to have for example, a large Spanish population that you're going to be recruiting, it would be best to translate the consent forms instead of using the short form, just because that can be, you'd only end up being able to use it 3 times and then you'd have to translate the consent form anyway. So it'd just be best to translate it. But if you are using the short form, you would include the English standalone HIPAA as well. And you would need to update the standalone HIPAA section to match the consent HIPAA section, which can be a little confusing. We just want to make sure that the same information is in there that is in like the English consent form is also in the Spanish consent form, or the Spanish, sorry, in the English standalone HIPAA form as well. You do not need to submit any like translated short form documents. We would just need the short form. We also have cases where study teams use an interpreter or a fluent study team member, which is great, but we need to see the certifications or a cover letter explaining the qualifications of the staff member. And this should just be explaining that this is their native language or that they have a degree in the language. We just want to make sure that the person who is presenting has the right, or the person that is acting as an interpreter is native in that language. So we are on to protocol. So just to start off with secondary research, which we see often, it is super important to use the secondary research protocol template and the secondary research application form. We have 2 application forms. We have kind of the standard application form, and then we have one for secondary research. And it is super important to use the secondary research application because that is how you apply for the HIPAA waiver and the waiver of consent for your secondary research. And if you do submit a regular application, we're usually just gonna have to send it back to you anyways, which would delay the review. So it's really best to just, if you're doing secondary, use the secondary application and the protocol. So we also have other protocol templates. For the new application, you have to use one of these templates because we launched a new application that is a lot shorter than our old one, but that means that your protocol has to be a lot more detailed. So we have one for therapeutic intervention, which is the IND/ID exempt. We have the observational or non-therapeutic intervention protocol template. We have the exempt categories 1, 2, or 3, and the GCP protocol template for drug investigations, the NIH protocol template, and the HDE protocol template. And HDE is a humanitarian device exemption. This is usually like kind of emergency scenarios, and you have to notify us of this. So for sponsor protocols, we are okay with you submitting those, but we would like you to submit like a cover letter or an addendum that explains what study procedures are happening at our site. It can be kind of confusing for us to look at a sponsor protocol, which aren't, specific for our site, and it might In those cases, it might be easier to use our protocol template, but we can definitely be flexible as long as there's some way that you're explaining what exactly is happening at our site. Still on initial submission, so we have mentored studies. And for these studies, we need a mentor agreement and a mentee PI attestation. Those are two different forms. And for mentored studies, the mentee cannot just sign the regular PI attestation form. There are specific forms that they have to sign, which can be found on our site. For mentored studies, the mentor has to be affiliated with the university and they have to be up to date on personnel requirements. I've seen a few scenarios where people have mentors that may have been at another school or they're with a different company and it just doesn't work, unfortunately. They have to be someone with the university. For mentored studies, we usually require a continuing review if the topic is sensitive. And sensitive studies include any studies where the disclosure of the participants' responses outside of research may place them at risk of criminal or civil liability or could be damaging to a subject's financial standing, employability, educational advancement, or reputation. One of the examples of those, if we have a mentored study where they are asking employees to give a rating to their employer, it might not seem sensitive, but if that were to be released, there might be some retaliation. So sensitive topics it can kind of seem like it's not sensitive, but that can be the case. So we also have recruitment materials. These are included in all submissions. We just want to know how you're recruiting your participants to the studies, and we want you to include those in the submission. So this can be scripts, and these can be scripts of emails, calls, texts, flyers, ads, or videos. We just want to see any way that you are recruiting your participants. And something that people often forget, which we understand, is that recruitment materials have to include PI name, COMERB number, and the version date. So that if you were ever to update in the future, we would be able to see that. And now we are on to amendments. So for amendments, when you're making changes to documents, we want to see the exact changes you're making. So for Word documents, we want to have both a clean version and a track changes version of those documents in InfoEd. So this would be the protocol, the consent form, recruitment documents, any of those Word documents we are going to want to see. You do not have to do this for the application form. We will do that on your behalf. So if you have any PDFs, we will do the compare for that. And just to do the track change in Word, you would go to review and hit track changes. But if you made changes to the document already, you can also do it after that. You can go to review, compare, and then you will choose the previous version and then they'll create a track changes for you. So still on amendments, we want to make sure that changes are incorporated across documents. This would be changes to risks, sites, enrollment numbers, inclusion, exclusion criteria, anything like that, we are going to want to see changes in. So just for an example, if you have a change in the risk, and this can be either increased risk or anything like that, we're going to want to see changes in the protocol, the application form, and the consent forms. So any forms that are applied, we are going to want to see those changes in, and you're going to have to do both a clean version and a track changes version. And this is especially the case for sites. The reliance agreements can take some time. So when you're adding a new site, you're going to want to have an amendment that is updating the site on all documents. We also know that sponsored studies can have a delay on your ability to update your documents. So we just like you to include that in a cover letter or some sort of explanation as to why there is a delay. So now we're on to continuing reviews. So if you are using a previous version of your continuing review form as a starting point, which is fine, we just want to make sure that you are updating that form. We often see study teams use the previous CRV form to make sure that their numbers are correct, but this can sometimes mean that not everything is updated, and so this can make some sections incorrect. One of the common things we see is for concurrent amendments. You can see maybe on the previous continuing review, you did not have a concurrent amendment, but this one you do, but you selected no. So that's just something that we would notice and something you would definitely want to double check as you're submitting to us. You also want to make sure that you are seeing which UAP, if there were any UAPs submitted in the previous year, if there were any publications and safety reports. They're all going to need to be updated from each continuing review and in the continuing review form. If you do check any of these boxes, please make sure that they are submitted with the continuing review. That's something we're always going to check and definitely needs to be accurate. On to the next one. So enrollment numbers. We want to make sure that numbers match across tables on the continuing review form. We have one section that is just for all all enrollments in the study, but there's another section that has a breakdown of the demographics. It's always important to make sure that those two tables are lined up and matching. And there are times when that's not the case and they can't match, but we would just want to know and you would just need to explain better. For multi-site protocols, we want to see enrollment numbers across the sites. And this is usually easier in a different form. So we would highly suggest that you upload a separate form that has a breakdown of the enrollment numbers across sites. And it's definitely something that we ask for. And I have seen this delay continuing review submissions often just because it can be hard to have a last minute check of the enrollment numbers across sites. Yeah, so definitely just make sure that you're double checking the numbers and make sure that it's in the approved amount. If you want to go above the approved enrollment number, you're just going to need to submit a UAP and an amendment with the continuing review so that we can be approved. For multi-site protocols, if COMERB is the lead site but not the single IRB for all sites, local continuing review approvals must be included as well. So now we're on to unanticipated problems. In these scenarios, you have to include safety reports, correspondence with privacy officers, if that applies, updates and correspondence issues by sponsors, materials related to the corrective action plan. So if any documents need to be updated for your UAP, please submit a concurrent amendment along with it and have a cover letter explaining that the changes made in the UAP that were explained in the UAP are now in the amendment. So there are times where COMERB will be the single IRB, and it's really important that you reach out to us early, and you can do that by shooting an email to the COMERB help desk with a copy of the protocol or the funding proposal. The study will have to be approved locally, and then you're able to add sites via amendments. And for external sites, please have them reach out to their IRBs as soon as possible to complete any local procedures. One of the greatest delays with single IRBs is just communication. So it is super important that you reach out to us first at the COMERB help desk and as early as possible, just so we can get the ball rolling. It can definitely be a lengthy process, and so the earlier you start, the better. External sites, it's definitely important that you reach out to the other PIs at the external site because it can just be a lengthy process, and it's best that those IRBs know ahead of time that we will be contacting them to start the reliance agreement. So for just-in-time submissions, we have the pre-submission, and this is where you reach out to COMERB as soon as possible. And again, you would just reach out to the help desk, and that's where you would include your grant proposal and the deadline date. And just same with the reliance agreements, it is so important that you communicate to us. There have been a few times where we have people shoot us a panicked email on the help desk saying that they need approval in 3 days, but we had no idea because they hadn't told us. So the earlier the better, just for both sides, so that the review can be as soon as possible and where it's not rushed and panicked. With JIT submission, since we know that you need approval as soon as possible, we'll likely give you an approval, but it'll be a shortened approval period, likely 6 months. So that gives you time to get things in order, and also allows us to check in on you again. And then once funding is obtained, we're going to ask that you submit all requested materials to us again. We want to make sure that all the documents are appropriate and in line with the just-in-time temporary approval that we gave you. So just some general tips for success. Just as I stated, please reach out early to us with any questions. We have 4 specialists that'll be at the help desk that'll be happy to answer questions and to get the ball rolling on studies. And we are always happy to meet. We also have office hours on Mondays from 12 to 1 on Zoom. And you can always register for those on our website. We also have submission guides and guidance documents on our website so that you always have those available and you can always check on what you will need for each submission. We also offer CTSA classes and you can find that schedule online. And you can always sign up for those. And those are also taught by our specialists and we are always
I had more green vegetables today than my dad's had in a life.
And then we also just before you submit to us, just ensure that all documents are consistent and complete. We do read and review through all of them, so we just want to make sure that everything is accurate. Thank you.
Excellent. Thank you, Elainya, for all of those great tips and tricks for COMERB submissions. I would like to open up the floor. If anyone in the audience has any questions, please feel free to type in the chat. Otherwise, feel free to unmute yourself and ask your question.
Elainya, this is Jatanya with the RAC team. I have a question regarding the COIs that come around every August.
Mhm.
We find that you say we have 3 months to get those COIs for everyone to get theirs all done, both
Yes.
sub-Is and the clinical staff. But what we see is that if they don't finish it within the first couple weeks, then our stuff, COMA won't approve our stuff because they're missing COIs. So it's strange to have 3 months to get your COI in, but it halts COMA approval unless you get it done sooner. Does that sort of make sense?
Yeah, definitely. And it definitely depends on the study. If it's a full board study, we just have kind of higher standards for that study, and we just have to have those personnel requirements in. Kind of as you go down, so expedited, exempt, we definitely get a lot more flexible, but I understand that can be definitely confusing to have us asking for the COI, but the COI team gives you that 3-month window. But we definitely try to be flexible, and you can always send us a message and be like, we need more time for the COI disclosure.
Thank you.
Of course.
I am seeing a question in the chat if the slides can be sent out or provided access to them. We are recording today's presentation, so this recording would be available. I will leave it up to Elainya if she feels comfortable sharing her slides, and then we can post them with our materials as well.
Yeah, of course, I'd be happy to share.
Awesome. Additional questions from the audience? While we're waiting for some wheels to turn, I had a question on the new submission form, and I was curious how that has been going and what sort of feedback you've gotten from your launch of the new submission form.
Yeah, we were very excited to launch the new application form because we had gotten plenty of comments before that the previous one was long and took a long time to complete. So we shortened that. That does mean that the protocols have to be a lot more detailed than they were previously, because now questions that were previously in the application form are now need to be explained in the protocol. So that's definitely kind of been an adjustment for that. And there's also been confusion with like the fee waiver in the application form. In the old one, depending on the answers that you had, the application fee would come up right away, but now it doesn't appear in the current application form. So usually you can just send us an email and we will work from there. But yeah, I'd say that's been the greatest difference is kind of the change in the protocol that are required in the protocol.
Excellent, thank you. And another question, I'm curious if you could share what you see most often in terms of like amendment or continuing review errors. What would you say the most common errors during this
Yeah.
process are?
I say that the most common error that we see in amendments and continuing reviews are definitely the personnel requirements. It's easy to forget them as you go from year to year, not just the COI disclosures, but also just making sure that your CV is updated and uploaded, and then making sure that your city trainings are up to date for everyone on the personnel form. It's definitely something that's easy to forget. Just with the gap in the city trainings, you have 3 years to complete them, and that can for 3 years before they expire. So that can kind of feel like forever and it's easy to forget about them, but definitely have to keep up to date on those. So I would definitely say personnel requirements are something that you have to keep up to date on.